Cancer is growth of cells which are unorganized. The cells are normally being produced in our body and they die. But these cells, which attain certain mutations, they don't die and they increase in number and subsequently a cancer is born. There are around 220 types of cancers and many things we can't control, we can't change. It is in our genetic makeup. But what we can do is these are modifiable factors. These are the factors which we can control by ourselves and we can decrease the risk associated with it. Lifestyle is one of the most important factors which we see nowadays. Many things which we can't change, like genetic makeup, but lifestyle, what we can do is that is in our own hands. Whether we are taking alcohol, whether we are taking tobacco in any form, whether we are having an obesity, there's various things which makes us more prone to cancer. So we can control these things and control the risk of getting cancer. Majority of the cancers we don't know how they are caused, but few cancers we know they are directly related to abuse or few things which we normally take. So if we change those things, we change our habits, we can decrease the risk of becoming a cancer patient. 99% of the cases which we get in India from head and neck, they are from tobacco abuse. Tobacco can be taken in any form, whether it is bidi, cigarette, or any sort of pan, masala, gutka, anything of that sort. This causes cancer. If this kind of abusive abuse is there, the risk of cancer is increased. Secondly, when we take alcohol, if we are taking alcohol and we are taking tobacco related products also, then the risk increases manifold. Thirdly, if we are having a sedentary lifestyle, our weight increases and obesity is there. Many things are there which increases the risk is increased because of being obese, like stomach cancer, colorectal cancer, endometrial cancer, breast cancer. These are all related to increasing obesity, which we see nowadays. The food habits are also being changed. We are getting westernized. More and more people are opting for over the counter food. So we are getting food in another 15-20 minutes, but this is not good for our health. And this also increases the chance of becoming a cancer patient. One of the most important cancers which we see is head and neck cancer. That is directly associated with tobacco intake. Almost every other patient who is having head and neck cancer, which is in fact the most common cancers in male in India, is associated with tobacco intake, plus minus alcohol. The second, which is one of the most important cancers in female, is breast cancer. This is also associated with increasing weight, increasing hormone replacement therapy, taking oral contraceptives. So there are various cancers individually which are associated with lifestyle and the risks are increased because of these. Most important thing as far as diet is concerned is that we should have only seasonal fruits and vegetables. Whenever these seasonal fruits and vegetables are there are less use of pesticides, insecticides, and they are not stored. Their preservatives are less. This decreases the chances of getting all those chemicals into our body and the risk is decreased. So I always recommend my patients to always use seasonal fruits and vegetables. Also, we should not be going heavy on alcohol, red meat. These also increases chances of bowel cancer manifold. Many times whenever we see that the preserved food items are there, the packed food items are there, I always ask my patients not to eat these and avoid these. People, whenever they want to enjoy, they want to go to a McDonald's or a pizza, I always say them, avoid these. Take more and more of vegetable. And nowadays it's a fad when we go and take organic food. So less and less of chemical in our body, the less and less chances of getting cancer. These preservatives and other chemicals which are used so that they can be stored. These food items can be stored for many weeks. These food items nowadays, apples are coming from Washington. So these type of exotic foods are coming from other places. So we need to give more preservative. These preservatives, these are not washed easily. These go, whenever we eat them, they go into our abdomen and they get digested, they get absorbed. These chemicals lead to certain genetic mutation changes into our genetic system and increases the chances of becoming malignant cells so that cancer can reduce. So I always say that whenever you are eating any fruit for that matter, you should always wash it with water So because children many times they just come and eat from the table itself. They don't wash properly. So it is always advisable to eat seasonal fruits. Again, emphasizing on this fact: seasonal fruits are best. And secondly, whenever you are eating any fruit, wash it clearly. Majority of the time, if we are physically inactive, our weight increases. So what happens? Obesity and other things are there. Whenever we are physically active, mentally strong, our body got impetus. So these cancer cells are normal cells. These are our own cells, but they are not behaving the way other cells behave. So whenever we are physically fit, we are having those physical exercises and all, we keep our body weight under control. So these negative radicals, which are normally produced by fat, these are less, and this decreases the chance of getting cancer. As such, there is no clear-cut guideline, or we can say, as such, there's no correlation as such, we can say. But whenever we have a cancer patient and the patient takes a lot of stress, the stress hormones are released, the recovery is slow, the immunity is down. So we always say that the patient should be very happy. He should have a stress-free life, and he should not have a negativity all around. Psychology play a lot of role in as far as recovery is concerned, especially in patients who are undergoing chemotherapy and surgery. This is one of the most important factor as far as the patients are concerned. Whenever we detect a cancer in early stages, the treatment is good, the survival and the prognosis is good. It's always said that we always treat patients as far as the stage is concerned, the primary disease from where it has started. If we have got, say, stage 1 disease, the patient recovery rates are more than 95 to 100%. But if it is a stage 4 disease, we cannot treat them. We cannot cure them. We can only increase the survival, or we can only have a better quality of life. So stage is the most important factor as far as the treatment of cancer patients are concerned.